So I'll work on this whole setup so there's like not a bunch of wires and things, but for now this is what we're gonna do. And I have a new microphone. Let me know how that sounds. We'll get it all twerked. And if I start looking down, that's because I'm looking at the chat. Okay. And when I answer, I'll try to look up I'm looking at you guys. Okay. I've missed you guys. This community is so amazing. I can't wait to talk to everybody. We did change the day. So instead of Wednesdays, it's going to be Thursdays now. Thursdays live at 5. And really, I'm truly trying to build a community here. So we can work with this too. We're going to change we're going to change some things up, do what works for the group for the most part. So just bear with us. And this is the first Thursday. I see some members here. Anyone that you see with a blue star is a member, which is amazing. Hey, Sally, you just refound me. Okay. So, if anyone's new, I'm hospice nurse Julie. In case you don't know, I educate about death and dying and hospice and palliative care, hopefully to help demystify it a bit so you can learn more and decrease your fear and just be a true advocate for yourself in your life and in your death. And I'm here to answer your questions. I go live for 1 hour, and that's what we're doing tonight. I have to tell you really quick, I didn't get a chance to watch the whole video, but someone just emailed me and said that a young girl who has brain cancer watched one of my videos, and then she has a YouTube following. So I haven't actually watched the whole video, but I'm going to. She has a YouTube following, and she was sharing in this video that, they gave her a terminal diagnosis and she watched my video. And again, I don't think my video helped. Like, I think she watched my video about end of life with brain cancer, and I think it made her feel worse. And I have to watch the full video, so I probably shouldn't even be talking about it, but it does hurt my heart. And I can totally see how if you're young and you get diagnosed with brain cancer and then you watch a video of mine being like, one of the hardest things to die from is brain cancer, it could be horrific. And I guess I'm just talking to you guys, generally speaking. That's never my intention. I always think, and I still believe, even if I never want to hurt anyone, I still do believe that knowledge is power, and knowing what's going to happen or what's likely to happen can give you power, bring you peace, help decrease your fear, help you prepare, help you live. But I still see how it won't feel like that sometimes. So I'm just thinking about that. I was literally just Yeah, you watched her video this morning. I haven't had a chance to watch the whole thing, but man, my heart is for her. Okay, first question from Michelle Parsons. Julie, do you know a change in the Medicare rules that are now not allowing a patient to continue dialysis, even if it isn't the reason you're on hospice? We are being told this. I have never thought that people on hospice could be on dialysis. I do know what you mean about, like, if they're on hospice for, let's say, lung cancer, but they also have end stage kidney disease, they usually are still allowed to stay on dialysis. I have not heard that, and I don't really run into that issue that often, if I'm honest, where most people on hospice don't continue dialysis and they die from that. But no, I haven't heard that Medicare is actually not allowing that. Are you a hospice nurse yourself, Michelle, or no? Is Alzheimer's considered brain cancer? No, that is a neurological disease. Brain cancer is cancer in the brain. I'm just reading some of the comments. Thank you to everyone who's here. Welcome, everybody. If you're just joining, I go live at 5. We're starting now every Thursday at 5 p.m. Pacific Standard Time, where I'll answer the questions I can, your questions best I can. How do I teach my 8-year-old to be okay with death? She always asks my age. She sounds nervous. Veronica, that is not my specialty. Children are not my specialty, right? And that's probably more of a It's a normal thing for children to be curious about death, to be curious about their parents' death. It's also an anxiety thing. So there could be just generalized anxiety, and then people fixate on certain topics. So that is something I would talk to a counselor about because it's probably a very common thing. Thank you, Ice L. Oh my gosh. Poor Tori. Tori, I'm so glad you're here. Thank you for sticking with me. She says, I think you did say horrific or something equivalent, like terrible or awful, but I appreciate your work. Thank you. And truly, that's a testament to you, Tori, about you still being able to be here on the live, talk to me, talk about it. That that's a testament to you. So thank you for being here. What are your thoughts on death with dignity, medical aid in dying? So you are there in Canada. Your medical aid in dying is a little different than ours. I'm pretty sure yours is federally funded and the doctors can actually give the medication and there's different qualifications. Here in the US, only 11 states are legally allowed to give medical aid in dying. Doctors or nurses never give it themselves. It's a powder that we give people. They have to mix it and drink it themselves. There's very strict criteria in order to get it, and it's only legal in 11 states. And even in the 11 states it's legal, not everyone has to give it to you. You basically have to find providers and doctors that will. But I'm all for it. Have I ever encountered a suicide survivor in hospice? No, I have not. I've encountered suicide survivors, but not in hospice. Michelle, okay, Michelle, if you're still here, I hope you are. We have had multiple hospice companies tell us this recently. My husband has terminal liposarcoma. We were not allowed on hospice because of not being allowed to continue dialysis. I would really, this might be difficult, but I would really try to look into someone who's like a Medicare specialist when it comes to hospice because a lot of hospice companies, I'm not saying they're purposely trying to lie to you, but most people just don't know. Most people just don't know. I don't know if there's anyone that you could get in touch with, or like try to find a specialist in this because there is a bunch of red tape, but it may be doable. I could be wrong, honestly. Just like I said, some people don't know. I don't technically know. Technically speaking, if it's not the terminal diagnosis, he should be able to do it. But if everyone keeps telling you no, I don't know, but I feel like someone might know, and um, it'd be worth looking into, I think. But it could be a little bit of a pain in the butt to try to find someone or get someone actually on the phone. But I'm be curious. If I can find out, I will too. Okay, just reading through the questions. Welcome everybody. Come on in. There's 229 of you here. This is going to be recorded and put on my page. Thank you, Edith. Thank you to everyone saying thank you. Thank you to everyone, saying they read my book, things like that. I really appreciate it. Doctors can prescribe CBD to old patients in hospice. Yes. Thank you, Michael. My mom has Alzheimer's, hasn't eaten solid food in 2.5 years, only Boost. Is this unusual? She needs 24/7 hands on and has been nonverbal for 2 years. Ellie, it is not unusual. As crazy as that sounds, it is not unusual. People can live for quite some time being fully nonverbal, fully bedbound, barely eating, barely drinking, and they still can live for quite some time. My suggestion to you would be do what you're probably already doing, which is keep her clean, keep her safe, keep her comfortable. Don't push any food, meds, or water. I mean, of course, like give them to her. But if she starts being like some days where she maybe will only take a couple sips and that's all she wants and she sleeps most of the day, allowing her body to be the guide in this time will be the best thing you can do for her body, which will naturally just shut down. And if she's having any if her body's having any real issues, it will let you know physically through nonverbal cues, yelling, moaning, being restless. But if it's not doing that and she's just sleeping most of the time, I would just let her body be the guide. Of course, you have doctors and nurses that you need to work with, but generally speaking, end stage Alzheimer's will look like that. And she'll just eat less, sleep more, eat less, sleep more until her body fully shuts down. So I know it's difficult, it's not easy. And I think whenever you're reeling in your mind, like, what should I do? How can I do this? Am I doing enough? Just ask yourself, is she clean? Is she safe? Is she comfortable? And if you can say yes, 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 you can kind of take a deep breath and relax, at least for that day, right? And then you can ask yourself those questions again the next day. But it's hard. Oh, Michelle, thank you so much. I'm just reading through these comments. Brother-in-law who is 61, having early onset Alzheimer's. He's gotten too violent to be home. Is this a sign of the end? Stephanie, I would say no, it's not a sign of the end. Now, I am not an Alzheimer's or dementia expert. I'm only an end of life expert, and I happen to see dementia and Alzheimer's at the end of life. So I don't see the beginning onsets of Alzheimer's. I don't see patients like that. I don't see them in their earlier stages. I see them 10 years in, right? So, but generally speaking, if he, depending on how long he's had it and what kind he has, right? I would talk to his doctor about that. But generally speaking, I wouldn't say this is a sign of the end. Usually, sign of the end with Alzheimer's disease is like not eating and drinking, sleeping all the time, not eating and drinking, sleeping all the time. Usually. Every once in a while, people surprise you. He's 11 years in. Okay. Well, as long as if he's still walking around and eating and drinking and doing his thing, you know, who knows? Like I said, I think the main things I see with people with Alzheimer's disease when they're getting close to the end is not really eating and drinking and sleeping all the time, meaning like 22 hours a day, maybe 24, maybe like sleeping all day, barely eating, maybe having a couple of infections, a UTI or aspiration pneumonia. So things like that. But it is hard. It's not black and white, unfortunately. I wish it was. I love knowing exactly what exactly everything is. Everything black and white in the know. I love that. I'm so comfortable there. And really, end of life is very gray. It's like, it's kind of this, it's maybe that, and that's hard. That's hard. Welcome, everybody. So nice to be here with you guys. I'm just reading through, and just so you guys know, we just started back with these lives. This is the first day back, and I'll do it every week on Thursdays at 5 p.m. Pacific Standard Time. Anyone you see with a green name and a blue star is in the membership program, and I am trying to form a community here. This is the one place that I'm going to go live weekly. So if you are someone who's a caregiver or has lots of questions or are grieving, whatever. This is what I'm hoping for, is a safe place for you to come to and not just listen to me blab on, which I'm happy to do that too, and answer questions, but also to talk to each other. When I was doing this before the summer, many of the same people came back week after week after week. So that's what I'm hoping to form again. And I'm glad you're here. So if you've also had experience from some of the questions that, we're getting, you can feel happy to chime in too. At what point with lung failure can I go on hospice? I already feel weak, can't care for self, feel like I'm dying, need help. Okay. So Heather, thanks, Michelle. Heather, I would talk to your doctor, of course. So this is not a place where I can give medical advice. Generally speaking, when it's any kind of like failure, heart failure, lung failure, liver failure, to go on hospice, you have to meet like very specific criteria. And it's usually very, very, very end stage. So you have to talk to your doctor about it. You usually have to be like on oxygen 24/7, like you said, short of breath with minimal activity or speech. You have to already be on like steroids and nebulizers. I think I already said oxygen 24/7, things like that. Because what happens with chronic diseases like lung failure or lung disease, you go through exacerbations, right? So you're going along and you have the lung disease and you have like oxygen and little things, but you're still living your life. But then something happens and you go down and you're down here and you're super short of breath. You feel like you're dying, like you said. Maybe you go into the hospital for a few days. Now you're on oxygen all the time. You feel like, man, this might be the end, right? And then you might even go on hospice right here because they think maybe this is the end. Maybe your disease is advanced enough. But then you start boop, 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 going up, 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 up. And then you actually can come off hospice and you start feeling better sometimes because in chronic illnesses, you have exacerbations. So it's like, is it the end or is it an exacerbation of your disease and you're just having like a bad month or so? It's hard to know. That's why you have to talk to your doctor. But if you are willing and ready to, you can always say to them, hey, I don't want to keep doing all this stuff. I want to go on hospice and at least try to get evaluated. So you can always try. You can always try. Michelle Parsons, welcome to the Compassionate Companions. Yay! I hope I get to see you week by week. My mom passed out on the commode and went labored. She released all bodily functions. Hospice said she wouldn't make it through the night. She woke up 4 hours later and said her mom sent her back. Janine. You know why people, this is side note. You know why people pass out on the toilet? Because you're usually bearing down. And when you bear down, you lower your heart rate because it like beta blocks you naturally. And you can, what's the word? Your vagus nerve gets activated and you vasovagal, they call it vasovagal, and you pass out. But you don't die from that. You usually pass out and wake up. Even very healthy people can do that. But her mom sent her back. Her mom sent her back. If I am missing your question and you're like, oh my gosh, Julia, I've asked her my question 3 times and she hasn't seen it, just type it in all caps. What are the first signs of kidney failure? What should I look for? So, Veronica, that's a little hard. So, what are the first stages of kidney failure? What should I look for? And if I can intervene before that stage? This is the part where it's like I'm always going to answer honestly if I don't know something. So I only really am an expert in when it truly is kidney failure, right? I'm not in the before it's kidney failure. So it's kidney failure if they have to go on dialysis. Are there things you can do? Probably. Depends on if it's genetics or if it's like lifestyle or like why you're having a kidney failure. So that matters. But I don't know. I don't know those things. I'm not I'm not like that's not my specialty, right? So I'm more specialized in like what does kidney failure look like when it's end stage? Does that make sense? How common is rapid breathing at time of death? Very common. It's called Cheyne-Stokes breathing and it happens a lot. So Cheyne-Stokes breathing can look like, and maybe this is not exactly how it was, but rapid breathing at the end of life can be normal and it can be really short, like, and then they hold their breath for a long time. And then they hold their breath. So it can look like that sometimes. Now, use your hospice team to know if is this regular changes in breathing or do they look uncomfortable? I would always err on the side of like, hey, let's err on the side of keep them comfortable. So if we think it looks uncomfortable, let's just give them some medicine. But usually end of life breathing is like a metabolic response to your blood chemistry changing and your body shutting down. So it's usually not uncomfortable. And if it was, your person would show you on their face, on their body, they would look and act uncomfortable. Thank you, everybody who's saying they like my videos. Okay, this is good. Michelle said, my husband's first signs of kidney failure were blood work abnormalities, yes, and needing to pee, but nothing coming out. There you go, Michelle. Thank you. Gail, I remember you. Nice to see you, Gail. Gail, I like you. Acute kidney injury, Sally. Yes, you can recover from that because it's acute. Usually, chronic is the one that's a little harder. Just depends. It just depends. Hi, everybody. How has working in hospice affected your view of your own mortality? What would be your perfect death for yourself if you could choose? So, generally speaking, my view on on my own mortality was changed a lot long before I was a nurse at all. My best friend had died when I was 17, which really put in perspective that I will die, and it could be sudden and violent. Could be. And then I had a few other friends die as well. So I had a lot of like very tragic young deaths, friends in my life that like a bunch in a row, not a bunch, but enough to help me understand that like I will die. Um and that affected me in a way, just in the sense of like really understanding that. And then being an ICU nurse helped me see that like I wouldn't want to die like that, and that like preserving life at all cost really can cause people suffering. And it's not preserving life at all cost is not what I'd want. And we're giving people a true it's a true detriment, I think, that we're doing that to people and their families. So that helped me wanting to get into hospice, and then watching the hospice people die on hospice was like, now it's not every time. It's not perfect every time, obviously. But watching it over and over again was what helped me be like, wow, if I whenever I die, which I will, I hope it's like this. Meaning like I hope that I do know I'm going to die. I hope that I do have time to prepare and know and kind of see it coming. And I would love to live very old. I would love to live into my 90s. Of course, it depends on my life circumstances, right? If all my friends and family are gone and I'm in tons of pain and I can't walk and can't see and can't hear or whatever, I probably wouldn't really want to be alive just to be alive. I'm okay with dying. So, my perfect death would be like overall feeling pretty good, dying of old age with people around me who I love. And that would be my ideal. But, you know, whatever happens is gonna happen. How about you guys? Do you guys have like a perfect a perfect scenario in your brain? And what do you think when I say like I truly do try to contemplate my own mortality every day, and not to be macabre or like indulgent in self-pity, but because it helps me like if someone was like, you're gonna die in 6 months, that would really reframe how I looked at my everyday life. I would enjoy the things that I take for granted, right? And I try to remind myself that that could be a reality someday, right? So it's like in the moment I'm in, the day that I'm in, how can I enjoy the water I'm drinking, enjoy the sunshine on my face, enjoy my soft bed, enjoy my work, enjoy my sister, my the calls from my dad, little things like that, big things as well. So, yeah. Who needs to have the hard conversation about moving into hospice, or who should lead it? I think anyone could. It's not really our place though, right? It's like if someone's you're not that close to is like doing their thing, and like it's not your place just to randomly go up to a person you kind of know and be like, "Hey, you should go on hospice." Um You can ask your doctor to have the conversation. You can, depending on how close you are to the person and if they can cognitively talk to you, you can openly start saying, I always say honesty first. I feel so uncomfortable talking about this and I feel scared and nervous, but I feel like it's so important. You could even bring me up for that. I happen to be on YouTube and there's this hospice nurse talking about blah, 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 right? Just trying to bring up the topic. So then and she says how important it is that we should all have end of life plans and we should all do it whether we're sick or we're not sick. So I think it's a matter of discussing it kind of now, like all of us here are discussing it, right? We should discuss this even before we're sick. So you could possibly bring it up like that. Um, but specifically, if you feel uncomfortable or like if say you're the daughter and it's your mom, you could talk to her oncologist and say, hey, can we all get together, get with the social worker and talk about end of life planning and when hospice is appropriate, when it's not? Can we get that meeting together? I really want to talk about it. And they should be able to do that. Hey, Stephanie. Queen, good to see you again. Michelle, I don't know. I mean, I would say yes. Michelle says an increased need for blood transfusion, a sign that body system is wearing out. We've gone from a few months to once a month now, about every 2 weeks. Sometimes, Michelle, again, you'd have to talk to the doctor working with you guys, because I only see patients when they're already coming onto hospice, when they're already on hospice. You know what I mean? So just from being an ICU nurse, I would say, yes, this could mean something, but I wouldn't always just take what a nurse on the internet says, even though it's me. Just kidding. But seriously, is VSED considered suicide? So VSED is voluntary stopping eating and drinking. No, it is not considered suicide. And I did a whole video about this. I think it's a beautiful concept that gives people control back in a time when they've lost all control. I'm sure it feels. So, VSED is legal in all 50 states. All 50 states you can do VSED. So if you have a terminal illness and it's going to be like a chronic life limiting illness that's causing you a lot of angst and you're like, I don't want to be doing this, but you don't live in a state where you can take the end of life medication, you can do VSED where you voluntarily stop eating and drinking and you end your own life that way. And it's illegal. I would work with a doctor. Like I would work with a doctor, get on hospice if you can. You can't always because it is a little uncomfortable. Your body's not naturally shutting that your hunger and thirst mechanism off yet. So initially you will have hunger pains, you will have thirst pains. The more strict you are, the quicker it'll be. If you truly do not eat and drink, you will die within 7 to 10 days, truly. Unless you're super young and your body's like really vibrant, it might take longer, but around there, 7 to 10, maybe 14 days. If you don't have anything. But that's kind of hard. That's kind of hard, right? So some people will stop eating and still drink. Some people will stop eating and drinking, but then be like, I'm going to have a sip here or there, which is okay. It just will take a little longer. So I would always work with a medical professional. You can Google VSED and there's so much information out there. I have a video about VSED with tons of resources in the caption. It is not considered suicide. It is legal in all 50 states. I think on the death certificate though, it is put, I don't think it's like the disease you died from. It actually might say starvation. Don't quote me on that. Don't quote me on that. But um, this is something you could do. People with dementia or Alzheimer's, like who or Parkinson's disease, right? You can choose if you don't want to, like if you start, you can choose with your doctor and put in your advanced directives that this is what you want to do. Now you will end your life early, but you won't have to go through that long progression of the disease. You can do that. That is legal. You can do that. You can also put in your advanced directives when I can no longer feed myself, which you won't really be cognizant, but your family will be able to watch. When I can no longer feed myself, you are legally not allowed to feed me. And it can be written and signed and notarized, and then your family won't feed you. So, food for thought. Food for thought. Blood transfusions are not allowed on hospice, as far as I know. Now, again, if it's for something else, not the terminal diagnosis, possibly, but we usually don't. Oh, Gail. Gail said, I had to make a very difficult decision to help a 6-week-old baby squirrel pass 2 days ago. Yeah, that is so sad. It's so hard to see an animal suffer. Janine says, Mom graduated from hospice. Her words, your videos help me because I feel alone and now I have high anxiety. Healthcare agencies don't do much. Yes. I mean, hospice companies in general, we do the best we can, but we don't do that much, really. I mean, neither do home health. I mean, I get what you mean, but even hospice, it's like most of the work is still falling on the family. I'd say it's like 80-20. So people can come off hospice. When she said my mom graduated, that means her mom came off hospice. If you don't continue to decline on hospice and basically prove to Medicare that you're still going to die within 6 months, they'll take you off. And that happens a lot with people with dementia, people with Parkinson's, elderly people with like heart disease. So it just depends. Okay. Welcome, everybody. So happy you joined me. So just a little teaser. I think you guys know my boyfriend Rich, Mustache Richie. He's not here right now, he's at work. But him and I are thinking about teaming up and on these lives, instead of doing a live like this where I'm reading, we are going to do it just like this, but he'll be sitting next to me. We'll have like me and him, he'll be like my little sidekick, helping me monitor questions coming in, and I'm going to have call in questions. So do you remember the show what's it called, with Dr. Drew, Loveline with Dr. Drew, where you'd call in and ask a question about like a relationship? I'm going to allow you guys to call in and ask me a question. And I mean, of course, I'm going to have to field if anyone's being crazy, but generally speaking, it's going to be like a call in show where then we can really get into depth of like certain circumstances that happen to you, and like I can hopefully help. So we're thinking about switching the live to that. And right now there's only like 200 and some people, so we could really get to a lot of questions. And then if you're not comfortable too, Rich will be fielding the chat as well, so he'll be able to help with that. But that's what we're thinking about. Thank you guys. Oh, good. I'm glad you guys like it. I feel like it's a little more intimate too. Oh, Ashley, I know. Thank you for WD Boss. I'm just reading through the questions. Thank you guys. Wow. Someone just wrote, Janine, I hope I'm saying your name right, just wrote, in a certain county here in Michigan, hospice has to call the police when someone passes to rule out assisted suicide because it's the county where Dr. Kevorkian lived. No, that's wild. We educate people on our hospice to never call the police if someone dies because it's not a crime. It's not a crime scene. Don't call 911 because then it kind of turns into a whole thing. But wow, they actually have to. Dr. Kevorkian, he was ahead of his time, I think. Good for that man. He went to jail just on principle because he was like, my patients deserve this. I'm a caregiver for an elderly man with Parkinson's who is on hospice. Where should I store the comfort package? That's a great question. So, most patients on hospice will get something called a comfort kit or a comfort package. Ours is in a box and it will say, like, do not open unless a nurse is here. So, once the nurse comes, you can open it. And some of the medications will say store in the fridge, some will say keep in this box. So I usually say if it says store in the fridge, if there's suppositories, I would store in the fridge because suppositories can melt. And then all the rest, I would just follow the directions. Generally speaking, I would just keep them in the box and because you don't have to use them and just know where that kit is. And then whoever is going to be the caregiver, if the caregiver switch out, just let them know the comfort package is here or whatever, right? It doesn't have to be, it depends on the household. So legally per hospice, like you don't have to lock it up or anything. You have to work with that family to see what they want. But generally speaking, just follow what's on the package because it'll say whether you should refrigerate things or not. But there's no special place. You don't have to hide it. You don't have to lock it up. Of course, there's some people who will anyway, and that's just their choice. Great question. I like when you ask us questions that you and Richie want to find the answer to. Yes, Rich and I are really active on Instagram stories together because him and I are quite different. So like he's older than me. So there's a little bit of a generational gap. And he's kind of like he's like the younger side of Gen X. And I'm the older side of millennials. So we're pretty close. But I kind of act like a young millennial and he acts like an old Gen X. So we're like his references and my references are like very different. And he's so much smarter than me. I'm not even being mean to myself. He's really smart. His vocabulary is almost annoying. Anyway, we're very active on Instagram stories together. Would you ever do a video on dying from pulmonary fibrosis? Hope, I haven't done that because honestly, I haven't seen many patients on hospice with pulmonary fibrosis. I've seen many in the MICU, the medical ICU, where I've only worked a few shifts. Um, so I don't feel super confident in like doing one. I could kind of generalize what I think it would be like. But I don't think that's very fair. So I don't do it because I don't see it very often. Is it normal for someone dying to have multiple end of life signs for 2 days and hospice thought he was dying, but then bounce back and have a week of normal days? You know what? Anything's normal, I guess. I would say no, that's not that normal. If it was the true rally where someone's like gonna die and then all of a sudden burst of energy, usually they only have that burst of energy for a couple days and then they die or go back down. Now he could be having, I don't know why I said he. They could be having a particular long rally, but usually rallies only last for a couple days. This could just be the ebb and flow of someone's disease, particularly if they have like a chronic illness that has turned terminal. They can usually go up and down. But people personality plays a lot too. If someone's like old and stubborn or young and stubborn or just stubborn can play a role for sure. Maribel, I have many videos. So she says, my grandma's dying. Can you tell me what last hours of death look like? Like she's blue, breathing pauses, but she still wakes up sometimes. Okay, so one, if she's on hospice already, Maribel, please talk to your hospice company. So if this is currently happening right now, you talk to your hospice company, okay? Because they'll be able to tell you. I also have several real life actively dying videos that you can show. I cannot, unfortunately, tell you exactly what's going on with somebody if I'm not there and I'm not their nurse. So I'd have to know a lot more information for me to actually answer that. Generally speaking, if you have a doctor or nurse that you're working with right now, you need to talk to them. If they can't give you an answer and the answer is we just don't know, you just have to wait and see, right? Then you ask yourself, is my loved one clean? Are they safe? Are they comfortable? How do you know if they're comfortable? You look at them, and if they're not rolling around or moaning or furrowing their brow, then that means they're most likely comfortable. So if you can say yes, they're clean, they're safe, they're comfortable. If you can say yes to all of those things, all you have to do is take a big breath in and relax and just be with them. It can be uncomfortable waiting for someone to die. That's it, and period. And just because it's uncomfortable doesn't mean it's wrong or that you're doing something wrong. And sometimes it's just a matter of waiting, and that's really hard. I hope that helps. Hi, everybody saying hi. What's your craziest experience, Julie? Man, oh man, I have so many crazy experiences. Have you ever felt scared as a hospice nurse? Jen Claus coming in hot with two good questions. So my crazy experience and ever felt scared. So my craziest experience, I don't know, man. I've had some crazy experiences. So in the ICU, I was working in Baltimore in the ICU. I've had crazy experiences with just crazy surgeries and crazy trauma things that happen with patients. And I was their nurse, and you just see so many crazy things. Um, I have felt scared in people's homes. I have felt scared by certain patients' family members sometimes. You just you get the bad vibe feeling. Certain old Hollywood buildings feel a little scary sometimes. I had to deal with a lot of yeah, there's just some sketchy situations I've been in that felt a little scary. Nothing bad has ever happened, but just felt a little uneasy. Um I had one patient who did not want to take any kind of medications for their disease, and their disease was a bunch of brain tumors. So you usually have a lot of symptoms with brain tumors, but they didn't want to take any medications. So they had a lot of symptoms their whole entire dying process, and that was not scary, but that was sad and really horrific to watch. And then I've had many unexplainable things happen, which I have tons of videos about. I could go into it here. I guess I could, huh? But I mean, I have so many videos about it. You can just go watch the videos. So I have a video called like the miracle story or the angel story. That's one of my craziest stories. I have a shared death experience that I think all those videos will say like I don't fear death or how not to fear death. Something about not fearing death. That'll give some pretty cool stories about this miracle I witnessed, and I think I saw an angel. And there's one where I feel like someone showed me what it was like to die. And those are all videos I've already made. So I have had many crazy experiences. Do blue extremities feel numb or hurt? My dad, who passed 5 months ago, turned blue but unconscious. Just curious. Very normal, Lori. It's because of how our blood is circulating throughout our body, which it's really not at the end of life. So your fingers and toes and even your nose and your lips can kind of turn blue or purplish or like reddish, almost like sausagey looking. Your knees can turn different colors. All very normal, not painful. And it's just because our body's shutting down. So the blood is not flowing as it should. If a patient has adult children out of state, what signs would make you tell the family it's time to tell them to come home? This is what I always say about that. So, depending on how close you are to the family member, I would always say the time is now. Like if someone's going on hospice, the time is now. Don't wait until they're taking their last breaths to come home. So you can actually spend time with them while they're still awake and alert. But let's just say that's not the case and they're like, "No, we don't actually want to come home to see them awake and alert. We only want to know like right before they're dying." Then I would say they're fully unconscious, not eating and drinking, fully unconscious and not eating and drinking at all. If that is happening, your loved one should come. And then once they start changes in breathing and they have like terminal secretions, then it's like it really will be probably only a couple days. And if you ever want to know like what those signs look like, go watch my videos called anything that's labeled actively dying. You'll see examples there. Think of yourself. Yes, someone said, "I love the story about the man who said, 'Oh, Julie, if I only would have known.'" Yes. This person's talking about that shared death experience I was talking about. So I had a patient who I was really close with. And they were dying. I could tell they were very close. They were going to die that day. And I like said my goodbyes to them in my head and went to my car. And then suddenly I heard their voice in my head and he was saying my name. And he was like, "Oh my gosh, Julie. Oh my gosh. If I only would have known. If I only would have known." And he was basically telling me, if I only would have known how good this was, I wouldn't have been so afraid. And there's so much more to that story, but that's like the main message he sent me was like, "Oh my gosh, Julie. Oh my gosh, Julie. If I only would have known." It was so beautiful, so magical. Oh, thank you, Jenna. Thank you, thank you. Have you become attached to any of your hospice patients and cried when they passed? How do you cope as a nurse since you will see death again? I have become attached to patients. That patient who gave me the shared death experience, I definitely was attached to that patient. And I definitely cried, but I was so happy too because he gave me that experience where I basically felt like he showed me what it was like to die and he was so happy. So it was really hard to be like sad that he was gone. I was so happy for him. I've cried, of course, when I felt like people have suffered. There have been patients where I felt like, man, they really suffered, and it really, really, really makes my stomach hurt, and I just feel awful. I've cried with families because the patient's young, and yeah. So yes, the I'm giving you a long answer to a short yes. I've definitely gotten attached, but how do I deal with that? Is I think being an ICU nurse for so many years prior to being a hospice nurse, I have a really good perspective of what the other side looks like. We cannot preserve life at all costs. We can't. End of story, period. Everyone's going to have an end of life journey. There are some people that get certain diseases and it sucks and they will die from them and it sucks. But trying to preserve their life at all costs, I have seen what that looks like. And I would rather do it the hospice way than the other way. So it feels sad, but to me, it feels like I'm so happy I get to be a part of this. I'm so happy I get to comfort them. I'm so happy I get to control their symptoms. I'm so happy I get to be a person that isn't afraid to talk about their death and give them relief by helping them understand how it's going to look and feel and how it's going to be when they're dying. Like there's so much relief on their face when they finally see that someone they're talking to someone who isn't afraid to talk about them dying. It's usually not sad. They're usually relieved and it feels really good. It feels really good to help somebody. So yes, there are hard days, but generally speaking, I feel like I'm doing a good service, if that makes sense. My nose is itchy. Can you say your thoughts on will directives for left on ventricular? Do you think there's specific time to tell them to stop any extra measures? Oh boy. The Zen ginger. That is too I can give a general thing. Um, but you should really talk to your cardiologist, really. You should really talk to your cardiologist. You don't want to turn something off like that. Wait, for being left on a ventilator. Oh, okay. My god, I read that so differently. I thought you were talking about ventricular, some kind of heart device. Yeah, so a ventilator is the machine that when there's a tube that goes down to your lungs and then you're hooked up to a machine that's breathing for you. So you can write very specific things in your will and your directives about what you'd want for that. So, yes, I'm okay with being intubated and on a ventilator for X amount of time. 2 months, 3 months. Yes, I'm okay to be ventilated if the doctors are saying I'm likely to come off the vent and survive, right? So that's where the doctors have to be honest. What's the likelihood of them so like if I got in a bad accident tomorrow, I would want to be intubated and ventilated. But if an EEG was done on my brain and they said I was brain dead, I'm going to have it in my directives that take me off the ventilator if an EEG shows I am brain dead, right? Or if a doctor is saying I'm not going to be restored back to my normal self, take me off the ventilator. So you can put very specific things in there, very specific things. And I would take into account your age, diseases you have, different comorbidities you have. So those things come into play. So if you are like a 92-year-old, and again, this is not like I'm not trying to be like ageist. It's just if you're 92, you're end of life, even if you're the healthiest 92-year-old, you're still end of life-ish, right? So the idea of if you're ventilated, you probably had compressions, most likely chest compressions. So the idea of being like resuscitated and ventilated and stuff in your 90s, probably not the best idea. Can you still do it? Of course. But someone should have a long talk with you about what that really means. Because it's probably just prolonging suffering. So it does really, really, really depend. But you can get super detailed in wills. Do I think our loved ones can see us? You know, I think generally speaking, it doesn't matter what I think because it's just a belief, right? Like I can say, yes, I think they can. But I think what matters is if like you think they can or whoever, whoever I'm a hospice nurse. Like I'm not someone who would know, I'm not someone who has a fierce opinion on that. And even if I did, I would never push my opinion on someone else because I don't think that's right. But yes, that's my but yes, I do think they can see us. I certainly hope so. I hope they can see us. What do you think? I got interested in becoming a hospice nurse because I was an ICU nurse. So I was an ICU nurse for 8 years, and then I became a hospice nurse. I don't talk about things privately, I'm so sorry. We don't have to talk about that situation here, but I can't talk privately. One good thing so just to but I appreciate you asking, like, I never care if people ask me things, but I will always hold boundaries that I wanna hold, and I hope people are okay with that. That's one way I've, like, learned how to have a really good work-life balance is by holding good boundaries. I do that in hospice nursing as well. So, the way I don't get, like, incredibly sad or incredibly attached to people is because I have really good boundaries, and I don't think that makes me a cold nurse or a bad if anything, I think it makes me a good nurse and it helps my longevity in nursing because I know that other nurses are just as good as me and they can do the job just as well as I can. So I don't have to be the end all be all for patients' families. But young patients, horrific. And no, unfortunately, I can't do private talks. But I'm really glad you're here. And thank you for being a nurse. Why is it so easy for someone's power of attorney to override a DNR? Right? Tori, I don't know. Every other week I used to have a special guest on and I'd ask them questions. And I had a lawyer on once, and I should ask them that because it does seem like it's very easy, doesn't it? See, you do say the word horrific. Tori, play the tape back. No, I'm just kidding. I'm just kidding. Uh, Tori, you are hilarious. How's the book selling? The book is selling well. It made it on the New York Times best-selling list thanks to you guys for the first week only, which of course my like my perfectionistic ass is like for only 1 week. Seriously, Julie. It's amazing. It's amazing. It's easy for me to be like it should be more, but it's not. It's great and it's selling well and thanks to you guys. And really to me I always remind myself it doesn't matter like I want it to sell well so people can get help, but generally speaking like I whoever needs to find the book will find the book, right? I hope anyway. Black Dash. Oh my god. Thank you, you guys. Okay, listen, we got 3 minutes. It's been an hour. So, thank you so much for everyone who's been here. I will see you back here again Thursday, 5 p.m. Thursday, 5 p.m. If Richie and I can get our ish together, maybe we'll do the call in by next week. Probably not because it's going to be a lot to like go into it, but maybe. And if not, then we'll do it to the same way we're doing it here. You guys type in your questions and I'll answer best I can. And you guys can talk to each other in the chat. And you'll see once this starts building up, we're going to get a community here going again. And I'm going to be so excited. Thursday, 5 p.m. I'll see you there next week. Bye, guys. Thanks for the support.